Hi, thanks so much. Thanks for having me here today. My name is Elizabeth Buzney, and I work in Boston, Massachusetts, at the Brigham and Women's Hospital as part of MGB Dermatology. So there are a few reasons for the misdiagnosis. The first one is, as we already talked about, the lack of visible rash. You can't look for lesions. And again, if you think of who is most often presenting with this, sometimes we do make this diagnosis in adulthood. But I think most often we make this diagnosis in childhood. And so we are looking for parents and pediatricians and ER docs to make the diagnosis. And they really have to have their ears alert for what could be going on with the child. It's often helpful if other family members have the diagnosis too. That definitely helps that child. But sometimes the child can be the first one in their family to present, and that is just so difficult. So that's number one, lack of visible rash. Number two, it's tough to test for these labs, and we all know how uncomfortable we are ordering those porphyrin for testing. We like to send our labs to Mayo. It's really the only one lab in the United States that offers specific protoporphyrin 9 testing for EPP. And it's that very specific erythrocyte protoporphyrin fractionation lab that you're looking for to order from Mayo as a send-out lab, unless you work at Mayo. Why else can you miss a diagnosis? Well, patients may underreport their symptoms due to a lifelong coping behavior. They think, oh, well, I'm just sensitive to sun. I just don't go out in the sun. I can't do that. And then again, many clinicians are unaware that EPP pain is immediate and severe without that rash. The consequences of this can be years to decades of diagnostic delay. It's actually great when a child is diagnosed early because then they can get the support that they need in so many different ways. I think the story is much harder to hear when it's someone that's been dealing with this undiagnosed for so long that has severely impacted their own lifestyle, their school, their work, their mental health, what they allow themselves to do, the activities that they do. And so as a result, there can be reduced quality of life and psychosocial burden. And then the other consequence, which can be huge, is this risk of hepatic complications due to protoporphyrin accumulation. This is rare but serious. So it's really incumbent on us to make this diagnosis and then to follow the liver to make sure that the liver doesn't have any ill effects from the protoporphyrin accumulation.